Dear colleagues, so when we are discussing new opportunities of monitoring and treatment, well, first that comes to mind, use the modern methods of visualization together with AI. That's the new method, and the use of new methods which have appeared in the field of treatment of this or that particular disease. So what are the methods of imaging? What kind of methods of imaging? First of all, that's the pictures of the fundus. That's what the world has been using for decades. And of course, AI was used first and foremost as far as this method is concerned. Now, let's look at other retinal disease. It can be diagnosed using these particular pictures. Why we use about the fundus? Well, funduscopy became very informative. Now, through the narrow pupil, we can get the picture of high quality, not only of the center of the retina, but also of the periphery, as is seen in this particular case at our center. We used the fundus imaging. Peripheral dystrophy, central dystrophy can be clearly seen. Moreover, modern cameras have inbuilt algorithms of AI. Imagine just within 1 minute, when you take a picture, when there is a patient with a narrow pupil, you can make a diagnosis, well, age-related macular degeneration or retinopathy and peripheral retinal dystrophy. You can see the newly formed vessels, as in this clinical case, will be visual here. But speaking about the diabetes mellitus and the glaucoma as two comorbid conditions, here the situation is much more complex. The thing is, in case of diabetes mellitus, there is early thinning of the retinal nerve fiber layer, the same as we see in case of glaucoma. In type 1 diabetes, well, the photoreceptors will be also thinned, but in type 2 diabetes, thinning of all retinal layers will take place, as it was shown in the publication of this year. Also, the choroidea will be thinned, and retinal and choroidal thinning in the foveal and parafoveal areas, accompanied by a reduction in multifocal ERG. Here is the example from our practice. You can see the case report of a patient with type 2 diabetes mellitus. Again, you can see the retinal fiber is thin, but the pressure is normal. This is a patient with diabetes mellitus, which is not diagnosed with glaucoma. But the question is how to treat this patient if we see this kind of changes similar to glaucoma. Should we just monitor this patient with diabetes? The patient will be on metformin in this case, which is a neuroprotector, as I have already mentioned before, or should we administer hypotensive drugs such as fotonafrost? And I mentioned in my first presentation that it can be useful to treat the diabetic retinopathy. This is still an open question. Nevertheless, right now, there are new drugs such as lactoculin and others. It doesn't contain preservatives, but it can be used for 3 months. It has a very convenient vial for patients, and we can use this particular drug because the treatment in this case will be quite long. Of course, imaging methods of the optical nerve head were used together with artificial intelligence, and here is the algorithm for early diagnosis of glaucoma in particular. Moreover, the use of such maps of the optical nerve head and the fundus and nerve fibers per se, we can see whether the patient has a glaucoma progression or there is a glaucoma without the progression. Naturally, the methods of OCT and perimetry were used together with AI to determine progression of the disease. And of course, the multi-model approach is more perfect when we can use both OCT and the imaging of fundus and perimetry data. But unfortunately, there haven't been enough studies like this in literary data, we did not see any studies when multifocal approach or algorithm was used, but we developed a model. There's a need to develop a model that at the start of the disease could allow us to make a prognosis about the nature of the disease and the course of the disease in a particular patient. Our goal is to develop such a model, and we divided patients into three groups depending on the speed of progression according to the standard model. And in this study, we used modern methods of deep learning, discriminant analysis on the basis of the partial least squares, and we also used the OCT angiography, and also we analyzed the density of chorial capillaries in this area, used OCT angiography for the optical nerve head, macula, while the membrane, the curvature index, and other methods of diagnosis. We divided patients into two groups depending on the stage of the disease, the early stage and advanced severe stage. That's group two, and that was a retrospective study that we carried out for 3 years. The experts assessed the progression, and we compared the conclusions with the data obtained on the basis of the AI algorithm. The algorithm showed the highest sensitivity and specificity, hence the efficacy for both stages of the disease. Well, you can see, well, the area under curve is um, point 0.9. Also, these algorithms allowed us to identify early predictors of progression. They were slightly different for the early stage and advanced stage, but we did not identify the predictors such as IOP only at the early stage. Well, there was corneal hysteresis, which was an important predictor, but at both stages, there were biomarkers as predictors, and what is important for the early stage is the chorial capillaries, as you can see it here, and the thickness in the low temporal sector. And again, you can see such predictors as the parapapillary vascular density, ganglion cell complex thickness, retinal nerve fiber layer thickness in the inferior nasal sector. You can see an example of the patient with this advanced stage. You can see the structural CT, and you can see the loss of capillaries in the radial sector. And again, this is one of the reasons and the biomarker of the rapid progression of glaucoma. And here, when we analyzed this situation, if at the early stage we could use this particular model, this algorithm, we could predict rapid progression of glaucoma right away. I have already mentioned chorial capillars and or choroidal microvasculature, and I should say that many authors, observe that it's one of the predictors of the progression of the disease. This is associated with the thinning of the layer of nerve fibers, and there are a lot of studies like this. For example, here is an article published this month in the Glaucoma Journal, which is devoted to this problem, association of choriocapillaries dropout with central visual field damage in myopic glaucoma eyes. This is the continuation of of the presentation that were made before. But the limitations of method is that the choriocapillaries dropout in each case should be identified by hand. That's the analysis done by hand. So that is why this particular chorial capillaries dropout done by hand. When we, for example, needed to do the assessment of one eye, it takes 10 to 15 minutes, and we lose the exactness of the assessment. That is why our goal was to develop and automate the method of the qualitative assessment of the choroidal microvasculature drop-up dropout, we used the yellow V8, that is the neural network, and we developed the neural network architecture. You can see the area under the curve. This is the violent curve, which has 0.92, that's area under the curve. Then we divided the patients into three groups, depending on the stage of the disease, to see how this parameter corresponds to different diseases, different stages of the disease. And from stage to stage, the choroidal vasculature dropout area will be increased. At the early stage of glaucoma, it is different from the norm. That is why we can use this parameter to differentiate patients with glaucoma from healthy individuals. And we identified the threshold that would allow us to determine the disease, the stage of the disease, and to make a prognosis to some extent. The improvement of choroidal blood flow can be used by using carbohydrase inhibitors such as dorzolamide and fixed combinations of dorzolamide with timolol. And in this case, there will be the improvement of the retrobulbar blood flow as it was showed. And again, you can see it here, especially when we're talking short capillary arteries. I would like to draw attention to the fixed combination dorzolamide and produced by Severna Zvezda, and in this clinical example, you can see the favorable course of glaucoma with the long follow-up period up to 5 years. So there was no progression of disease, and what is important, the blood flow hasn't gone worse, as CT angiography shows us. And this is an example of a combined disease. You can see AMD and glaucoma, and again, in this case, this particular drug should be uh, recommended, dorzolamide, timolol. We can also identify the blood flow, velocity, and even to determine the characteristics of the vessels. When we use the fundus camera, you can see the patient with AMD and the initial stage of glaucoma. We identify the vessel, and we can see that the wall of the vessel was thinned. And again, when we divided patients into two groups, as it is shown here, we noticed that the velocity of the blood flow is basically the same in both groups, but the thickness of the walls of the vessels are different. Moreover, the thinner vessel, the thinner wall, a narrowing of the diameter was in the group with concomitant pathology, and it was lower in case of glaucoma as compared to ADM. We assume that our patients have atherosclerosis, hypertension, and this has an impact on the retinal blood flow on the one hand, but also the glaucoma as a process may have a negative impact on the ADM in terms of hemotransfusion of the retina. Here is an example of a clinical case when we have the stable disease, and again, dorzolamide, the field of vision is unchanged for many years, and you can see the blood flow in the radial plexus, in the deep plexus has not changed. This is another example. Many patients have neuroprotectors administered in this case. And here I should say Mexidol, which as a drug is positioned by many ophthalmologists as an antioxidant. It is being used by cardiologists and nephrologists as an antioxidant. But colleagues, today we talked a lot about the mitochondrial dysfunction, mitochondrial diseases, and I would like to emphasize that Mexidol has this particular property to have an impact on mitochondria, and this has been proven in one of the clinical trials where patients who were on Mexidol forte, they had peripheral blood drawn, and the mitochondrial segments of lymphocytes were studied, and while treated, well, there was a positive shift noted characterizing the condition of mitochondria. A lot of clinical trials were conducted in different regions of the Russian Federation. These were small trials, but recently we published a meta-analysis of these trials. Altogether, 80 patients with POAG of various stages, and there was also a placebo group. The proposed maxidol treatment regimen is 500 milligrams solution parenterally for 14 days. You can see followed by maxidol 40 to 150, one tablet to 150 milligrams, 3 times daily for 90 days. So as you can see it here that the drug has had a favorable safety profile. But since the field of vision was measured only twice, I think we should continue to conduct such studies to show the efficacy of Maxidol in terms of maintaining the retinal function. Here is another important technology, anterior segment imaging. We have different methods of imaging, and this is one of them. Well, you know that ultrasound, well, is also quite rare, unfortunately, in this case, but OCT of the anterior segment is used more and more in clinical practice. And here I would like to show you the camera called the Cassia 2, the Japanese manufactured camera that allows us to achieve the high level of imaging of the tissue of the anterior segment. You can see the basal membrane dystrophy. The epithelium is very well visualized. Well, the lens, you can see complications in cataract surgery when we need to solve the lens and so on and so forth, as you can see it here. And of course, this is a very progressive method, but it's difficult to it's difficult to overestimate the capabilities of this equipment for ASOCT because the mechanisms of the angle closure can be different. It's not just the pupil block, it can be the lens mechanism or related to iris or discoidal dysfunction. It's possible to determine only when you study the anterior segment of the eye. We can have many parameters, not just the width of the eye or the width of the camera, but also the thickness of the retina, the curvature, and the square area. Well, here you can see the parameters analyzed here, as well as the height of the vault of the lens, and this is very important. And you can see sometimes it's difficult to pay attention to a particular thing when we compared the patients with the suspension of the angle closure. We saw that at the initial stage of this disease, patients are different from the norm if they have a disease that's interventricular space and the height of the lens. There is another study conducted in China, in Zhongshan province. That's the so-called Z trial, where patients with the suspicion of the closure, primary closure of the angle, were monitored for more than 13 years. One eye was treated, and the fellow eye is still under control. So this is the natural condition of the angle closure. I'm not going to give you the conclusions, but let me just give you the recent data concerning this study. It turned out that for monitoring of these patients, and not all patients, should be subjected to laser iridotomy, it's impossible to monitor the dynamics. I would like to emphasize the dynamics of two parameters that could be seen on the OCT of the interior segment. These are the same parameters, the area of the space and the height of the volume of vault of the lens. But there is a need to monitor patients, not just one-time measurements. What else can we see during this scanning, you can see visualization of the iridotrabecular contact area, and you can see synechias that we may not sometimes see and evaluate, and it is also important. It is also important to assess it in dynamics. At the top, you can see iridotomy, and on the right, you can see that there is no iridotrabecular contact, and again, you can see there is no peripheral iridotomy, and on the right, you can see that there is a contact, and there is a higher ophthalmic tone and progression of glaucoma, like in this clinical case, despite the iridotomy, the disease progresses. And again, you can see the iridotrabecular contact remains in this case, and it is quite pronounced. The most radical method of treatment is the removal of the lens. As you can see it here, the lens was removed, but it doesn't happen all too often. Here is another example. There was the iridotrabecular contact, but after this iridotrabecular contact, it remains in a smaller volume, but still maintains the higher ophthalmic tone. And here is an example of the positive course of closed-angle glaucoma. The patient was monitored for 8 years, and we can see that the disease is not progressing. The blood flow is normal, and again, without treatment. So you can see this example of long-term observation and effective treatment of PACG, follow-up period of 8 years, uh, emulsion performed in 2019. But if the contact remains, what drugs can we recommend? It was shown that prostaglandin analogs are the most effective, especially such as hematoprost, and especially fixed combination with timolol, such as Gimoca. Cheverner Zvezda is the manufacturer, and here is another study showing the effects of brimonidine, which is much better than valcartin, and it expands the angle of the anterior chamber and can be recommended in its fixed combinations with timolol, for example, Brimonide, which is a new drug. Please pay attention to this medication. And finally, what are the new achievements in treatment? I have already mentioned the analysis done on the basis of biobanks in the UK and in the US. Here is another interesting study. These data are being published because we have new trials, metabolomic trials. These are patients with different pathologies, with different methods of treatment. How often glaucoma develops in these patients? How is it linked to systemic therapy? And here are some unusual data obtained, colleagues. It turned out that calcium channel blockers increase the risk of the development of glaucoma by 23%. Recently, we thought that these drugs are neuroprotectors. You probably remember that, and there were several dissertations written on this topic, and right now we have quite the opposite data. It was proven that intraocular pressure does not change, but the thickness of the layer of the nerve fibers due to the treatment with these drugs will be lower. Beta blockers decrease intraocular pressure because there is a system impact of these drugs. Antidepressants, anti-diabetic drugs did not have any higher risk of the development glaucoma, but some of such drugs, for example, bupropion and the anti-diabetic metformin, which I mentioned earlier, as well as beta blockers, reduced the risk of developing glaucoma. So these are very unusual finds that allow us to think about treating patients with comorbid diseases. So new imaging technologies and the use of artificial intelligence methods open up new prospects for monitoring and personalized treatment of glaucoma in combination with comorbid conditions. Thank you very much.